More will be revealed on the condition of Tiger Woods in the coming days and weeks, including his quality of life moving forward, let alone the lesser question of whether he might at some point be able to resume his golf career in the wake of a catastrophic rollover car accident. Posted on Woods' Twitter account early Wednesday was the following statement from Dr. Anish Mahajan, Chief Medical Officer and Interim Chief Executive of Harbor UCLA Medical Center, describing his condition. Mr. Woods suffered significant orthopedic injuries to his right lower extremity that were treated during emergency surgery by orthopedic trauma specialists at Harbor UCLA Medical Center, a Level 1 trauma center. Com-minuted open fractures affecting both the upper and lower portions of the tibia and fibula bones were stabilized by inserting a rod into the tibia. Additional injuries to the bones of the foot and ankle were stabilized with a combination of screws and pins. Trauma to the muscle and soft tissue of the leg required surgical release of the covering of the muscles to relieve pressure due to swelling. Dr. Kenneth Jung, an orthopedic foot and ankle surgeon, provided further explanation of that summary. Although Jung is not involved in the treatment of Woods, he spoke in general terms about the type of injuries described, which commonly occur in high-energy car crashes. That the injuries occurred to the lower right leg of Woods is not surprising, Jung said, because those typically happen when a driver is slamming on the brake, as opposed to the left leg, which might be off to the side. The demolished front end of the SUV that Woods was driving appeared to be compressed and caved in by the accident. The tibia and fibula are the two bones in your lower leg, and a com-minuted fracture refers to a bone being broken into multiple fragments, as opposed to a clean break. The term open means the bone broke through the skin and was exposed to the outside world. That greatly increases the risk of infection, as occurred with Washington football team quarterback Alex Smith, who suffered a gruesome leg break that, after subsequent infections, brought the risk of amputation and was life-threatening. A lot of people focus on bone injuries, but that's only part of the tale, said Jung of the Kerlan-Jobe Institute in Los Angeles. The soft tissue envelope, or the skin, is actually very important as well. If you don't have skin covering the bone, it really doesn't matter how the bone looks or heals. With Woods, or anyone who suffers an open fracture, these first few days after an accident are critical in charting the path forward. It's usually pretty routine in the first 24 to 48 hours to bring someone back to the operating room to wash out the tissue, wash out the wounds again, re-inspect the tissue to see if there's any necrosis or tissue death, Jung said. The tibia is the shin bone you can feel under your skin.